is Dr. Haley Tyke. I have worked in pediatrics now for 8 years.
My name is Ainsley Velarde.
My name is Kelly Hennessy.
My name is Barbara Murphy.
Yo me llamo Corina Pinto.
Me llamo Beatriz Ramos.
Yo soy Dana Libaver.
Y yo soy Zuleika López Lizojo y somos terapeutas de salud mental.
Yo pienso que es muy importante tener una clínica separada para los adolescentes porque hay muchos temas de salud aparte de la pediatría general que ellos quieren conversar con un proveedor de salud médico.
Making the patients feel comfortable, I think that's our #1 priority in the adolescent clinic.
I think that teen clinic here is unique for a lot of different reasons.
And we can see them at any time. You know, we're open 7 days a week. If they need us, we're here. In Teen Clinic, we want our patients to be more interactive. We want to give them the skills so that they can start to be the focus of their own healthcare, so that they know what's going on with their bodies, so that they can make better decisions, and that they can learn as they get older and move into the adult world to navigate the medical system.
Yo fui paciente aquí en la clínica de adolescentes cuando yo tuve 16 a 18 años. Mis experiencias personales fueron increíbles con los proveedores, con el staff, los asistentes médicos siempre estaban ahí para apoyarme en ese tiempo de mi vida que fue un poco difícil y para todos los adolescentes puede ser difícil.
I think it's very important to have a separate space for the teenagers. Just the developmental milestones, how they're growing, it's different than the general pediatric population. The changes that they're going through mentally and physically, I think it's appropriate for them to be separate from the younger kids because everything in their life is completely different. And we can gear the teen clinic more towards what's appropriate for the teenagers.
Yo mismamente cuando me encuentro con un adolescente, siempre digo que lo que vamos a hablar primeramente es confidencial, porque ellos tal vez tienen miedo de preguntarle a uno, ¿le vas a contar a mi mamá? ¿Le vas a contar a mi papá? Entonces yo dentro del cuarto los saludo, pregunto preguntas para sentirlos más cómodos. Primera cosa le digo que es confidencial y después ¿por qué viniste hoy? ¿Cómo te podemos ayudar?
One of the reasons that I came to EBNHC is because of my interest in working with teenagers. I think that it's a really difficult time, in part because you're not a kid anymore, right? So you're still treated by a lot of people as a child, but you are feeling more and more like an adult, and yet a lot of society doesn't give you the freedom that adults have.
Tratamos de crear un ambiente cómodo, confidencial, ayudarles con servicios de salud mental, consejería, también enseñarles los servicios que hay para ellos en su adolescencia y hacerlos sentir cómodos, como deben de ellos saber que hay personas que les pueden ayudar en cualquier problema que tengan.
I think the health center has great resources for all of our patients, especially teenagers. We have a whole team of care coordinators who work endlessly to help our patients just build a better life, whether it's with housing or community resources. They're also implementing a new program to help set up continuing education, which I think is so important for our patients. So whether it's continuing their education, going to college, talking about how they're going to finance their way through college, or set up programs for them to become medical assistants or CNAs. I think it's great.
Aquí en la clínica podemos conectar pacientes a varios recursos en la comunidad, como pacientes que identifican con el LGBTQ comunidad, que significa lesbianas, homosexuales, bisexuales y transgéneros. También podemos conectar con recursos sobre violencia entre parejas y violencia doméstica. También podemos conectar a recursos sobre planificación familiar aquí en la clínica y a algunas otras organizaciones que están en la comunidad también.
Well, my role here is a little bit different than the other clinicians in that I generally work at the high school, at East Boston High School. So I have probably the most solo adolescent experience, and I find that their needs really range widely, from needing different situations like housing and food, or just needing a little bit more attention to their immunizations, needing some help with confidential matters like STD testing, condoms, birth control, that kind of thing. But I think a lot of what we do with adolescents is just actually listen to what's bothering them and try to help.
Hay dos tipos de terapia a lo que nosotras podemos llegar a referir. Uno es terapia individual y el otro es terapia en la casa, y la terapia en la casa también son los que involucran también al resto de la familia.
Sí, y muchas veces lo que se hace es que se le refiere a uno de los programas que ya mencionamos, y ellos tienen distintos servicios, terapia individual, y entonces la terapia en el hogar también son distintos. Hay terapia para la familia, hay terapia específicamente de conducta, hay terapia también que es más de mentoría, hay coordinadores de servicio, y esos son los tipos de programas a los cuales nosotros referimos.
I think some of the challenges that I see a lot of teens facing have to do with issues related to identity. So, trying to figure out who they are in the context of their families, in the context of their peer group, trying to figure out what they want to do with their lives. Realistically speaking, those things manifest as sometimes conflict between friends and the teen, or conflicts with family members, which are a common part of growing up. I think the other thing for teens is just trying to figure out what they want to do with their lives, and within that, how school fits in, how to move, beyond high school to the next step. Those sorts of issues I think are very common.
It's normal teenage stuff: conflict with their parents, issues with school, the first boyfriend, the first girlfriend, peer pressure, alcohol use, the first time that they become sexually active. They have questions: is my body the way it should be? Do I weigh the right weight? Am I different than other people? Am I the same as other kids? Teenagers, I think, like to be unique, but they don't want to be that different from their peers. And when they perceive that they are, that can be very stress-provoking to them. They worry about school. They worry about the world, on what's going on in the world. They worry about their families. And that's all comprehensive within the teen clinic. The actual physical part of doing a physical or a physical exam is just one tiny part of the whole picture of teen clinic. Their emotional health and their social health is just as important to us and to them, and sometimes more important to them. And we try to touch all of those bases and make sure that they feel welcomed, that they feel listened to, that they feel important and supported here within our teen clinic system.